Alrighty, so our patient is a middle-aged male. He was injured on the job in an oil rig about 4 years ago, and he's a transtibial amputation on the left side.
He's very active. He likes to wakeboard and play with his kids, and then he also works on the oil rigs. With all that, he has broken 4 legs.
He has he doesn't wear any sleeves under his, over his residual limb, and he has a flex bar foot, and he has 3 specific prosthetics. One is specifically used when he is working on the oil field. The other one is a active leg, and then the other one is one that he just wears when he goes out in the community. And he says that he goes to the gym 2 hours a day.
And some problem areas, he has a hard time swimming, biking, and then he's also had to alter his job quite a bit working on the oil rig.
And he also has problems with uneven grounds. As his children are growing bigger, he reports it's getting more difficult to carry his children, and also single leg stance. He is unable to balance on his prosthetic leg for greater than 5 seconds. And for his gait, we didn't notice any deviations. It was pretty normal, and it looked good, yeah.
So to analyze the single main problem area for Joe, we think that it's that he has some difficulty maintaining balance on uneven ground.
And the reason for this is because, the reason this is the biggest problem area is because his job involves walking on a lot of uneven surfaces and going up and down pitches. And he just gets really tired and sore when he has to do this a lot, and he has to take more frequent rest breaks at work.
Our question for the instructor, since our patient is so highly motivated and very active, how are we able to have that discussion of maybe stepping it down without having him not be active?
Yeah, we don't want him to lose any of his motivation, but he has broken 4 legs, and he does work 12-hour days, and we're just concerned about risk of injury and being able to continue at his level of activity in the future.
The intervention we'd like to highlight is to address his pain, discomfort, and redness on the anterior distal aspect of the residual limb. We would reinforce and reteach the hamstring gait to him to modify that aspect that's causing his pain, and then also to challenge his single leg balance and the uneven surface balance in the PT clinic using various sources to create that uneven surface.
So for special case topics that we would want to research, since he is so into lifting weights, we would want to look into if there is specific exercises or ways of lifting or special prosthetics for weightlifting that could help him to be more efficient with that.
Because like Joe mentioned that he only does lower body about once a week just because he can't do full squats and a lot of the leg exercises because his prosthetic pinches him in the back. So it'd be interesting to see what the evidence shows for different kinds of prosthetics and also what kind of strengthening exercises he can do with a prosthesis to make sure obviously the prosthetic still fits and everything like that.
Thank you.